Hello, everyone. Welcome to the NAHQ membership info session. My name is Stephanie Mercado. I am NAHQ's CEO and Executive Director, and I am joined today by Carol Pulaski, who is the President of NAHQ's Board of Directors. Today, I'm going to be going through a very brief slide presentation just to give you an overview of the benefits of NAHQ membership and talk to you about all that is on offer by being part of the organization that really supports the profession of healthcare quality. I will also invite Carol to provide some of her feedback as well in terms of what some of the benefits have been that she has personally experienced, because as a longtime NAHQ member and someone who is continues to be very supportive of NAHQ and supporting the development of the individuals within her own workforce, I think her feedback would be very interesting and hopefully material, so that you could figure out how to make the most of the membership. I also wanted to point out that at the end we will have a Q&A, and you can ask questions of either of us or both of us. So let's get started. So at NAHQ, our mission is to prepare a coordinated, competent workforce of healthcare quality that will lead and advance healthcare quality across the continuum of care. This is really, really important as we see the healthcare quality profession taking root outside of the traditional space of acute care. While NAHQ represents the acute care audience quite well, and we have deep roots in that space, we are seeing a lot more people come in from other areas, including, outpatient-related services, even pharmacy, behavioral health, and managed care, just to name a few. So all are welcome in NAHQ's membership. And our vision, really, why we're doing all this, is to make sure that the healthcare quality profession is recognized and valued as essential. Having had the opportunity now to work at NAHQ for 5 years, it's been really exciting to see this profession really take off. And it's more and more people are understanding the value of the profession of healthcare quality and the people who do that work. And a lot of that is because of the defined competencies that NAHQ has put together that really help people to understand what it takes to be a quality professional and to do that work well. From a membership perspective, just giving you a little bit of background, we know our quality people are data people, and so we always like to share some numbers with you. Our membership has been on the rise, and currently we have just around 7,500 active members in NAHQ. We have worked hard over the past few years to make sure that the value of membership is strong, and we do that in a lot of different ways. One of the ways that we do that is from the Journal of Healthcare Quality. JHQ is a peer-reviewed publication that comes out 6 times a year, and NAHQ members have access to that for free. We send them a printed version every other month, and they have online access always. And that is a wonderful reference place for what is going on in healthcare quality and where the research is really driving improvement across the country. Additionally, we have, as I mentioned, the online access will allow the articles to be archived. And we also have CE associated with each of those, with some of the articles from JHQ, which really helps count towards the CPHQ recertification. In addition, we also offer learning labs online and on demand, and those are free to NAHQ members as well. So a few years ago, we really started to spend more time building out more content for our members, and as recently as about a year ago, we started offering all of that content for free, because we really wanted to make sure that we were removing barriers between our members and the content that they needed to continue to develop and thrive in their career as quality professionals. And so I'm going to take a quick second and ask Carol if she could maybe give some insights into her perspectives of how this has worked for her as a quality professional, having access not only to more content than NAHQ has ever offered before, but also the CE that is now complimentary as part of membership.
Thank you, Stephanie. Hello, everybody. This is Carol Pulaski. This particular slide makes me smile because I don't know how many of you have been in this healthcare quality profession as long as I have, but for so many years, we've had to hunt and peck to find something that is relevant to what we do in our day jobs every day. And what you get with the JHQ, the journal, is that you actually get articles, as Stephanie said, that are peer-reviewed and are pertinent to what we're doing. So that, to me, has been a huge step forward. It has enabled my desire for lifelong learning, that I can use this journal. And then you have the learning labs. And as a NAHQ member, I get to access these learning labs, both on demand and live, free, which is a very important thing to me. As we all know, budgets are very tight. And it's hard sometimes for my manager to approve all the education I want. But to be able to access these learning labs and to be able to earn those CEs at my leisure when I can do it instead of having to leave my day job, my work, to go attend something like this is so important to me. And then the topics that are covered go beyond what I do in my everyday, because as a member, as a healthcare professional in the managed care arena, these journal articles, these learning labs have allowed me to learn what is beyond my sandbox so that I can interact with other healthcare professionals and we can all work together towards that quality outcome that we are all striving for. And on top of it, I get CE credits through each one of these products. So I think that this is an absolutely wonderful opportunity for anyone considering NAHQ membership are these products that we give to our members at no cost.
Right, and certainly helps with the CPH. Yeah, sure, and certainly helps with the CPHQ recertification process as well. So that's outstanding. Thank you. One of the other things we'd like to highlight is our CPHQ. It's the Certified Professional in Healthcare Quality. Just a few months ago, we celebrated crossing the threshold of 10,000 active CPHQs, and no sooner did we hit that milestone did we achieve the 11,000. So the momentum behind CPHQ is outstanding. And I think the reason that the momentum is so strong, again, relates to the competencies and the fact that employers are recognizing and quality professionals are recognizing that having competencies to really do the work of healthcare quality and to deploy that toolkit which you have through the CPHQ is incredibly important, and to have that designation is really increasingly powerful. I think some other things that are making that designation increasingly powerful are the partnerships that we've been able to forge with Jefferson College of Population Health, Northwestern University, and UAB. All three of these organizations now recognize CPHQ for master's level credit in these programs that they're offering. This was really outstanding because as we talk about the profession of healthcare quality really thriving and having the momentum that it has, this is another proof point of that. We know that educational pathways are opening up for this profession, and to have CPHQ being tied to that and really recognized as foundational in advanced learning is outstanding. Not only that, but these organizations, many of them will offer discounts to NAHQ members who want to pursue the degree programs. And those discounts are as much as 25%. It really depends on which organization you decide to pursue your learning with. But that has been an outstanding accomplishment, I think, for not only NAHQ getting the certification recognized, but it really just bolsters the certification that everyone else has. And it puts that higher ed within your reach with those potentially deep discounts off of the programming. Another thing I want to mention to you is regarding the career resources. Career resources are something that is a growing offer for NAHQ. And the reason why is because we aim to be the professional home for quality professionals. Certainly, we know that content around healthcare quality is important, and we offer a lot of that. But what we also do is try and help those individuals who are in healthcare quality really thrive in their personal careers. And so some of the ways that we do that is by offering a career center. We currently have 210 jobs listed on that career center online now, which can be accessed through our website. We also have online communities so that you may network and share across the country with individuals who do work like you. We also just this year at NAHQ Next, which we'll talk about in a few minutes, spent some time really building out our professional development zone. And it was in the center of the show floor for a reason, and that is because that we think that the careers and the people in our membership are the center of everything, and we wanted to put that really right in the hot spot of the show floor and offered there professional headshots. So we had a lot of people, I think hundreds of people went through and got their professional headshot, which were outstanding and have all updated their LinkedIn profiles and other career resources that they had. We also offered space for career advice. So there was an entire section of the Career Resource Center where we had usually 3 or 4 career coaches coaching our individual attendees on how their resume should look, what kind of job openings there are. Some people were thinking about taking a pivot. You know, I've worked in acute care. I'm looking to move to managed care. How would I do that? Some other people said, I've been involved in quality for a long time, but healthcare is new to me. How do I make sure that, you know, I stand out and get hired? Those were some of the things that were going on in that professional development zone with those professionals, professional recruiters that we partnered with to give that advice. And then certainly there was a lot of networking there. Additionally, we just this spring launched a new code of ethics. This is very important for a profession to have a code of ethics, and was really great for NAHQ to update the code of ethics that we had published previously, because the environment continues to change. And we know that one of the single biggest identifiers, again, of a profession is to have a code of ethics. So we see the graduate pathways opening up in this profession. We see the ethics continuing to be elevated in this profession. We see the jobs increasing in this profession. So that's really been outstanding, and we're trying to kind of pull all of that together for our members. Another thing that our members will have discounted access to is education at every level. We offer the HQ Principles content offering, which I'll talk about in more depth in just a second, the CPHQ preparatory materials, and HQ Essentials for advanced and master practitioners. The HQ Principles is an online course that a lot of our members are getting value from, not only because the content is excellent, but because the price is right for the members. We are offering deep discounts for our members on this content. And this offer results in a certificate, not a certification, but a certificate in healthcare quality upon completion. So there's great pre and post tests, there are case studies, lots of interactive opportunities to keep your attention and engagement throughout the 3-ish hours of instruction that is in the HQ Principles. If we were going to label what this is, we would call this sort of the 101 level offering for NAHQ. It's great for beginners in healthcare quality. It's great for a refresher for those who have been in healthcare quality for a while. And it's also great for those who are not in the quality departments at all, but who just work in healthcare. I actually went through this course myself and thought I've worked in healthcare for 17 years and worked a lot with physician and provider organizations before my time with NAHQ. And I thought, wow, this would be great. Every single person in healthcare would benefit from this type of content. And so more and more we are seeing individuals and corporations training themselves with these tools. The CPHQ prep products are also offered to our members at a discount, and those are the things that will get you ready to take the exam. We offer live review courses. We offer online review courses. We have HQ Solutions, which is a textbook that we just released in its, I think, 4th edition just a couple of months ago, so that is hot off the press. And we also have practice exams so that you can, take the test in a low stakes environment before you go and take the test in a high stakes environment. And we have received a lot of feedback that these prep products are really important, on their own, but certainly they function nicely as a group as well. So we're seeing people who want to buy packages of all of these and sort of plan to and study in a multimodal learning environment so that they make sure that they've covered all of their bases. So I'm going to take a moment here and have Carol provide some feedback. So her organization actually has invested in training through NAHQ and has really committed to quality. So Carol, tell us about where you work and what kind of value that your organization is getting out of NAHQ.
Okay, so I work for Centene Corporate. We are a very large Fortune 500, well, Fortune 100 now, company that has around 25 Medicaid health plans across the country. We're also in the marketplace arena. So we are opening new health plans continually, and all of our payment, as you know, is based on quality outcomes. So at this point, we are desperate for quality professionals, and we need to be able to train these professionals and have everybody on the same level so that we don't have to retrain and retrain. So we're bringing the CPHQ review course to Centene, and Centene has gone into an agreement with NAHQ. They're going to provide this to all employees who are interested. Centene is picking up the cost. They really want to put their money where their mouth is and support quality in all areas. So right now we have, at the last count, 165 employees across the enterprise signed up for this CPH review course, and they will be attending on-site and virtually for 2 days. They have committed to 2 days of attending this, and then they are going to be taking the CPHQ exam. So it's very exciting. We already have some people who have jumped the gun. They've gone onto the website and they've purchased some of the components of this prep package just to prepare for the review course. So it's in a very exciting time. I'm excited that Centene has absolutely supported quality and the foundational education that the CPHQ review course is offering. We even have some people outside of quality who are taking this, as Stephanie was describing before, just to better understand how quality fits into this new world we call healthcare, and how having a good quality foundation can actually increase the outcomes, the clinical outcomes that we're looking for.
Great. Yeah, that's outstanding. We're seeing more and more organizations reach out to NAHQ expressing a corporate commitment to quality and wanting to make sure that their individuals are trained. So we think that is outstanding because we know that individual quality professionals will do better in their roles the more people understand what they do, and the more people speak their same language. It's always easier for someone in a quality role to be able to speak to a peer and say and carry on a conversation when they've had similar trainings and certifications. So it seems to only be helping things. So the next thing I want to mention is HQ Essentials. HQ Essentials is a book that NAHQ published last year, and while supplies lasted, we sent this to we've sent it to about 7,000 or 8,000 of our members, and supplies have now gone. We have supplies, but they are now at a cost. We had a special promotion where we gave this book to our members for free for a period of time, and the results of this initiative were outstanding. So inside of this book is the competencies for advanced and master practitioners in healthcare quality. The book has been widely recognized and well received by the healthcare quality community, and is being referenced by those graduate programs and others that I mentioned previously when they're developing their curriculums for master's level content. So the content is outstanding. Members do not get it for free anymore, but they do get it at a discount, which we always offer our members discounts on any of the products and services that we offer. And so if you have not seen this, I highly encourage you to get a copy. This work has not only been recognized by the quality community, but has been recognized by the association community. As a nonprofit organization, we are committing and contributing to the greater good, and our way of doing that is through working with healthcare quality professionals. And there's other associations all around the country and the world that do the same thing to pursue their mission and objectives, even outside of healthcare. When we completed this work product, we submitted for an award from ASAE, which is the Association for Associations, where the best work products are recognized from associations from all over the world. And NAHQ was recognized with the Power of A award and received gold level status for this work. So we were very proud of that accomplishment and pleased that we can be developing this awesome content for our members. And the last thing that I'm going to talk to you about before we go for questions is to discuss NAHQ Next. NAHQ Next is the leading conference for the healthcare quality profession. We had our event last year in Cincinnati, and it was outstanding. We have some photos here from the show floor at that event. And we will be hosting again November 5th through the 7th in Minneapolis. There are three main things that you will experience at this conference, actually four, that I wanted to highlight. Number one, we do have we have the show floor, which does include our exhibitor partners. And like I said, it includes an intense focus on career resources as well. So there you will find a lot of great information to advance your career. Additionally, we have outstanding plenary sessions. NAHQ brings in some of the most sought-after speakers for plenary sessions, and those are the times in the day where everyone comes together to get focused on their career and the profession and the work in healthcare quality. And then we also have sessions, lots of breakouts. I think this year we have over 100 faculty that will be contributing to many breakouts at NAHQ Next, which are outstanding. And wrapped around all of this is a wonderful opportunity to network with peers and also to get good energy. I would say that the thing that struck me the most about this event last year was how it felt. The rooms were busy and energetic, and the conversation was so productive and positive and really there was a lot of excitement about the future of the profession and the professionals within it. So it's an outstanding event. I hope you will join me and Carol in November for this event. And I will let Carol give some of her comments about NAHQ Next and what she's looking forward to in Minneapolis.
Thank you. I wanted to make sure that I was able to speak in this portion because this NAHQ Next is unlike any conference I've ever attended. You know, in our business, in our day-to-day, sometimes we quality people within the confines of our organizations, we're not allowed to share. You know, we don't share with people. But at this NAHQ Next, there is such a sharing of effective policies, of things that have worked. And that, to me, it gives me goosebumps every time I go. As Stephanie said, the energy, when you get a bunch of quality people in a city together, the energy that is created is simply amazing. And the most important thing I know about NAHQ Next is after being in this profession for as long as I have, to be able to leave a conference with not one, not two, but several takeaways that I could actually implement in my professional life is, to me, so beneficial. So many times I go to a conference, my bar has now been set that if I can take away one new thing, then it was a very good conference. 3-day conference, one thing, it's still good. This conference, I have continually taken away multiple takeaways for me to use in my professional life. The other thing is, as we've talked before, is just to be able to talk to someone using the language. I know when I got into this quality business, the language, I actually had a cheat sheet that I had when, paper and pencil days, where I would write down words and then I would write the definition next to it so that the next time I talked to somebody, I would sound like I kind of knew what I was talking about. At some point, I think a lot of us got into this simply, we fell into it. There wasn't any formal education. There wasn't formal networking that we could take advantage of. But now NAHQ exists for this educational opportunity, like Stephanie has described, for this networking where you can take away those effective practices that you can utilize. So if you all have some time in November, come to Minneapolis, go on the website, see what's available in Minneapolis. I was amazed just to see that everything can be underground. I mean, you can walk the entire city underground. And I can't wait to go shopping at the America's Mall. But come to NAHQ next, see what the takeaways. I'd be really interested to see if other people give as many takeaways as I do. Okay, Stephanie, that's it. Thank you.
Thank you. That was great feedback. Thanks a lot, Carol. Okay, so now we will be opening the chat function so that we would be able to have the Q&A. So here we go. Let's see. I am currently working, let me not read it to you. Let me read it and then I'll paraphrase. Okay, so we have a question from someone working as a quality officer at a hospital in Abu Dhabi. Thank you for joining us. This individual is ready to take the CPHQ exam and wondering how to prepare for it and how much time that would take. The feedback that we generally hear from people is that 6 months is a good range of time to think about planning to take the CPHQ, and that if you study for 6 months, 3 to 6 months is a good investment, and that you should be well prepared if you spend that much time doing it. The resources for preparing for the exam can be found on our website, and we encourage you to do the online practice exam, the online learning course, and there's also our textbook, which you can order, and that is available electronically as well, so you don't have to worry about shipping to Abu Dhabi. So please check out our website, and if you have further questions, contact us at this info@nahq.org address, and our customer service staff will be delighted to help you. We have a question about, does someone need to be certified to attend the NAHQ Next conference? Definitely not. We actually get a lot of people who are just interested in learning about NAHQ and learning about NAHQ Next to come to the event, and often we see them converting to become certified after being bitten by that quality bug, but you do not need to be certified to be at the event. Question, does NAHQ provide discounts to organizations like Centene who want to train a larger workforce? The answer is yes, we do offer pricing discounts for those corporations who are going to train in high volumes, absolutely. And you can reach out to info@nahq.org again with specific information that you're looking for, and we'll get your organization hooked up with the right people here in our office so that we are able to talk with your corporation if you're interested. There's a question about a discount on membership for the listeners of this webinar. We are not offering a discount on membership to people who are participating in this webinar. We have, I think, a very competitive membership dues structure as is, with a lot of the value that we already offer, so there's not a code to get a discount. See. Oh, yeah. Someone's asking, is there a centralized location to search for quality jobs and careers via the NAHQ website? And is there a location where you can network to talk with other quality professionals? The answer is yes and yes. If you go to nahq.org/careers, that is going to be where you find our job board. And if you go to the website, and if you are a member, you will have access to the NAHQ network. And the NAHQ network is where you can go in and talk with people who are in acute care or behavioral health or who work in regulatory and accreditation, just to give a few examples. So there's a pretty extensive list of communities that you would be able to hop into if you are a NAHQ member. So we have another question regarding group membership relative to hospitals and how that would work for groups. I would encourage you, this is the woman from Colorado, to reach out to us again through NAHQ.org, because we may be able to support you with some group purchasing arrangement. So definitely reach out. We also have had another question about discounts on the CPHQ exam. Reach out to us as well. So this is from Mr. I'm not sure if Shushant. If you could reach out to us at info.nahq.org, we can talk to you about the different types of group discounts for the CPHQ prep and for the exam. I do not have all that information directly in front of me, so I do not want to misspeak. But we offer discounts on many things that people buy as a group or through a corporation. And so if you can be in touch with us, we could support your question specifically. That was a lot of questions. So what other questions are out there? I think we'll give it another minute while we wait. Carol, is there anything else that you'd like to add as just a closeout to the webinar?
No, I am just so pleased that so many people took the opportunity to join us today. I'd like to thank you for taking time out of your day. I hope the information that you got was beneficial in helping you to decide to join the association. And please, please, with any further questions that you come up with, just reach out at info@nhq.org. And we will certainly get back to you as soon as we can.
Okay, great. Well, seeing no other questions come through, I think that we've covered our bases here. So thanks, everybody, for your time today, and we hope to see you soon.
Thank you.